Oh, you are not buying anything for the house from me. Okay. All right. Good afternoon. Good afternoon. That's more like it. My name is Ben Nangombe. I'm the Executive Director in the Ministry of Health and Social Services. We are gathered here at the Media Center this afternoon for the purpose of receiving a donation from the government of the United States of America to the government of Namibia. That's the purpose of our gathering here. We have a very short program, and I wish to start without further ado. Honorable Kalumbi Shangula, Minister of Health and Social Services, Your Excellency Lisa Johnson, Ambassador of the United States of America to the Republic of Namibia, Honorable General Matundu, Deputy Minister of the Ministry of International Relations and Cooperation, members of the media, ladies and gentlemen, I will not say welcome to the Media Center. I will say good afternoon to you. As I indicated earlier, the purpose of our gathering here is to receive in-kind monetary and technical assistance from the people of the United States of America to the people of Namibia in the fight against COVID-19. It's apt and fitting that we are gathering here today because this has become the home where information about our COVID response as a country has been shared. And as you are all aware, the response to COVID is not a single-handed effort. It's an effort where individuals, institutions, and governments have lended a hand to this particular effort as we do what we need to do in order to protect the people of Namibia. So my task is to direct the program and to welcome you to this event. So consider yourselves welcome. And I will move on to the next item on the agenda, which is to call to the podium Her Excellency Ambassador Lisa Johnson of the United States of America to Namibia to come and deliver remarks. Let us welcome her with a round of applause.
Good afternoon, everyone, and thank you for being here so late in the afternoon on a Friday. We really appreciate it. I know it has been a long week and lots of big donations, so I wanted to say at the outset, I'd like to recognize all the governments, international organizations, and private sector companies here in Namibia that are supporting the government of Namibia's response to COVID-19. It's really a joint effort, and we are all in this together. And so today, I'm proud to announce that the United States, in joining this effort, is providing Namibian $100 million in assistance to Namibia to fight COVID-19. As U.S. Ambassador, many of you probably know that my priority has always been about partnering with Namibia to help improve the health of Namibians. We've been doing that for decades through PEPFAR on HIV/AIDS, with drought relief, food assistance to several regions of the country over the past year, and now COVID-19. This is a health partnership that works and is really helping to prevent the spread of COVID-19 in Namibia. The $100 million that we are donating today is going to help in several ways in the response. Specifically, it will help strengthen Namibia's lab testing capabilities. It will invest in local communities and their ability to fight COVID-19. It will improve Namibia's overall emergency responses to epidemics both now and in the future. And it will continue providing the best American medical and technical expertise to the Namibian government's response. Some of this assistance has already benefited Namibia. You might remember just a few weeks ago that I donated some ambulances, medical equipment, and supplies for isolation facilities throughout the country. And our American medical experts have been supporting the Namibian response to COVID-19 really from day one. Today we're handing over additional PPE for medical workers, which you see here, a part of it, but we will be coordinating with the Ministry of Health and Social Services on the delivery of more PPE, healthcare worker training, and upgrades for the laboratories in Namibia. The United States is demonstrating global leadership in the face of COVID-19, and internationally we've committed over $775 million US to the global response. The $100 million Namibian dollars for Namibia is part of our all-of-government approach to fighting COVID-19, and it includes assistance from the Centers for Disease Control and Prevention, USAID, PEPFAR, and the Department of Defense. This COVID assistance is building on our commitment to the health of Namibians that began decades ago working on HIV/AIDS. No other nation in the world has contributed more to Namibia and to the health of Namibians than the United States. And we're committing this Namibian $100 million so we can win the fight against COVID-19 as we're winning the fight against HIV/AIDS. I want to assure you that America is here with you in this for the long haul, not just today's donation, but we'll be partnering together in the weeks and months to come until COVID-19 is no longer a problem for our countries. Working together, Namibia and America will overcome COVID-19. Thank you.
Thank you very much, Ambassador. The crowd is rather small. Let's give the Ambassador a round of applause for that statement. You have heard it. The Ambassador spoke about testing and other issues, and when I was mingling with some of the journalists here, they have indeed been tested. Journalists are one of the target group. We are not saying we are going to test each and every journalist in the country. It's a matter of sampling so that we determine community transmission. That's the whole idea. So we are happy that our capacity to test has been boosted in this way as we upscale targeted testing to more and more parts of the country. So, Ambassador Johnson, once again, thank you for the statement. I said the program is short. The next item on the agenda is a statement by Honorable Dr. Kalumbi Shangula, the Minister of Health and Social Services. Again, do the needful and welcome him with a round of applause.
Thank you very much. Director of the program, Mr. Ben Nangombe, Executive Director, Ministry of Health and Social Services. Deputy Minister of Deputy Minister of MIRCO, January Matundu, Your Excellency Ambassador Lisa Johnson, senior officials of the Ministry of Health and Social Services, members of the media, ladies and gentlemen, good afternoon or good evening. I am heartened to have listened to Ambassador Johnson detailing the substantial contribution to Namibia's COVID-19 response from the government of the United States of America. This comes at a time when all the countries around the world are combating this deadly disease rampaging the world. Namibia is immensely grateful to benefit from the magnanimous generosity of the American people during this trying time, a time when their own country is engaged in a fierce battle to contain the disease and save lives. I therefore wish at this juncture to express, on behalf of the people and government of Namibia, our most sincere and heartfelt condolences to the people of the United States of America, to the community affected, and to the family who have lost their loved ones due to COVID-19. We also wish those infected, those admitted in health facilities, and those at home strength and speedy recovery. We are very much mindful of the mammoth task the U.S. government faces in their efforts to flatten the curve, given the sheer size of the population. Our thoughts are with you, and we should all be confident that the indomitable spirit of the American people will help your great country rise above this grave calamity. Director of Proceedings. Namibia has received accolades from far and wide for our achievement in the fight against HIV and AIDS. It is also a well-known fact that the U.S. government, directly and through its specialized agencies, have played a pivotal role in assisting Namibia to reach the stage where we can look forward to HIV epidemic control. Our partnership in this regard continues to grow from strength to strength. We are now once again standing shoulder to shoulder to fight another common enemy that has caused great harm globally. Like the rest of the world, Namibia has not been spared. Although we have not recorded any death due to COVID-19, there is no room for complacency. We have to fight this pandemic on all fronts and with all means at our disposal. Your Excellency Ambassador, I have to tell you that without having to be called upon, your staff have been with us from day one in our preparations to respond to the pandemic, and to this day continue to avail priceless resources, be it material, funds, skills, and expertise, and many other forms of solidarity that have bolstered our preparedness to fight the global scourge that COVID-19 has quickly become. We have done so as part of the Namibian, they have done so as part of the Namibian team. We applaud their unwavering commitment to providing only the highest level analysis technical input. We thank and commend them for their valuable contribution to our COVID-19 response and their eagerness to get their hands dirty to safeguard the Namibian lives. You can be rightfully proud of your team assigned to the Ministry of Health and Social Services, for we are rightfully thankful for their immense contribution. Looking at how the funds are allocated, I can confidently state that the assistance responds directly to our most critical needs. For instance, the ministry has committed itself to test 100,000 people for the coronavirus over the coming months, and a substantial amount of the funds that we are receiving today will be dedicated to procuring critical laboratory supplies, which will aid us greatly in fighting this scourge. This will indeed go a long way in meeting our targets and reassuring Namibians that we will deliver on our promise to save lives and help allow the citizenry and industry to become productive once again. The generosity of the American people will further strengthen our plans to ensure health facility infection prevention, which includes the construction of 15 prefab isolation units. It will also boost our health workforce numbers, increase our ability to conduct proper surveillance and contact tracing. Importantly, we will be able to scale up the training of our health workforce and strengthen our emergency operations. Your Excellency, I would like to assure you that the funds will be put to good use and that the Namibian government will utilize existing accountability measures to ensure that every dollar is accounted for and that is applied for its intended purpose to prevent, detect, treat, and care for all those infected and those who might be affected. Our brave, selfless, and committed workforce will surely be better equipped to continue their great work, which I strongly believe will pay the necessary dividends in the long run. Once again, I express our profound gratitude for this timely and most generous contributions towards the health and well-being of Namibians and all other people who call Namibia their homes, including the diplomatic and expatriate communities. With these few remarks, I would like to thank you for your kind attention.
Yes. Don't be shy. Don't hold back. Thank you very much, Comrade Minister, for those remarks. I said we only have a very short program. Having heard what the Minister said, expressing Namibia's gratitude to the people of the United States of America, yeah, it is indeed fitting. We are all in this together, and it is important that we support each other. We are moving closer to the end of our program. The next, before we move to the handover of the donation, I will invite the Honorable Deputy Minister of International Relations and Cooperation to come forward to express a vote of thanks, after which we will do a formal handover and then we will disperse. I juggled the program a little bit for convenience sake. Honorable Matundu, please, the floor is yours. Welcome the Deputy Minister with a round of applause.
Dr. Kalumbi Shangula, Minister of Health and Social Services, Your Excellency Lisa Johnson, Ambassador of the United States of America, senior government officials, distinguished guests, members of the media, ladies and gentlemen. Global health programs that the United States of America has funded have saved millions of lives in Africa, including Namibia. For the past 3 decades, the United States have stood with Namibia, especially in the field of health, with programs such as PEPFAR and the MCA, for which the government of the Republic of Namibia is very grateful. COVID-19 has caused uncertain human toll and economic hardship all over the world. And I would like to express my profound solidarity to you and the people of the United States of America as you are being hit very badly by this scourge. Namibia is no less safe from COVID-19, even though we have declared the state of emergency and ordered a partial lockdown of the country. We remain vigilant in the face of our health care capacity and the continuing pressure that our response strategies place on our economic resources. Our current situation seems to be less serious than the situation in the United States of America. But let me assure you that Namibia has no doubt that the United States will recover socially and economically in due time. I would like to take this opportunity to once again thank you for your solidarity and generous donation, which includes medical equipment, training and hiring of health care personnel, testing supplies, isolation centers, and PPEs. Your donation and constant moral support will assist us to defeat coronavirus. May I take this opportunity to thank our Minister of Health and Social Services and his valued staff members for their enormous efforts in fighting COVID-19 and the media for their constant coverage of our fight against the coronavirus, which educates our people. Thank you very much.
Yes. Round of applause for the Deputy Minister. Yeah. Yes, thank you very much. As I indicated, we are moving slowly towards the end of our program. The remaining part is for the Honorable Minister, the Honorable Deputy Minister, in Her Excellency Lisa Johnson, to come down so that we have a symbolic handover right here. So who's going to assist to move the boxes just to the other side? Oh, I see. Okay. Okay. It will be done here. Yeah. Can you just bring this to the center?
this in your car, okay?